Today I am going to be changing the dressing around an IV site. Before I walk in, I'll check the patient's chart again, make sure I have my equipment gathered in order to do so, and then I'll knock on the door, perform hand hygiene, inform the patient what I will be doing today, making sure my equipment is all set up, and then I'll put on some clean gloves. And then as I am performing this dressing change, we're gonna say that it doesn't look too good. I checked the last initials and the date on it, so it does look like it needs to be changed. If it's using the machine, I wanna pause the machine for now. If it's just using gravity, I wanna make sure I clamp all the tubing. And then I will take my alcohol prep pad. This just helps disintegrate that glue. And I will use the push-pull method when taking off the tape. I want to make sure I keep the catheter stabilized. Take my new alcohol pad. Make sure I get all that excess glue off. Letting it dry for about 30 seconds. And then take my skin barrier protective cleaner, cleaning everything after that first initial dry. Letting this dry again for about 30 seconds. All right. Once that is dry, I would not fan it like I did just there. Once that is dry, I will put new dressing on. I also want to make sure I initial this with the date, the time, and everything. And then when I apply the new dressing, I want to make sure it is occlusive. All right, and then once I have that new dressing tape on, I'll make sure I unclamp the tubing if it goes with gravity, or unpause the machine to continue the IV fluid. So now that that is done, say I have a next patient that I have to go to and I want to be removing the IV and they are all done with their solution. So of course the first thing I'll do is review the patient's chart, check the medical records and everything, gather all the equipment necessary, and then I will knock on the door, perform hand hygiene. Hi Susie, I'm just gonna be taking out your IV today since we're all done with your solution. All we're gonna be doing is just doing that real quick and then you will be all set to go. So I will put on a pair of clean gloves after performing hand hygiene again. And then I also want to make sure this is clamped, or if it's the machine, I want to make sure that I stop it. And then I will once again take my alcohol pad and using the push-pull method, I will take off that old dressing. And then I want to unhook the tubing. Once that is done, I will take my cotton ball, apply pressure where the catheter insertion is, and then slowly pull out that catheter. And then I'll keep applying pressure for about 5 minutes or until I stop seeing blood. And then can get my piece of tape, apply a new bandage, make sure Susie's feeling okay, ask her if she needs anything before I leave the room, give her her call light, return the bed back to normal position, and then I am all done and I can head out.